Hi everyone, my name is Tiffaany and I'm a social worker with a hospice upstate, and I was asked to talk to you about end-of-life care, the important aspects of end-of-life care, just give a general overview and talk about what it's like to be a primary caregiver. I've also attached a PowerPoint for your reference. So we can begin by discussing the definition of the term end-of-life care. It's used to describe the support and medical care given during the time surrounding death. So it is just an added layer of support to the patients and their families. And the goals include preventing or relieving suffering, to improve quality of life, and allowing the person to die with dignity, which means respecting their personal wishes. So patient self-determination is really, really big with us, and we want to make sure that we're doing everything in our power to make sure that we are doing what the patient wants. So there are two types of end-of-life care. Hospice care is what I work in specifically, and it's typically for individuals who have a life expectancy of 6 months or less. It involves pain and symptom management and comfort measures that enable quality of life. So we want to give people as much quality of life as possible in their final days. And the other is palliative care. So its main focus is improving the quality of life and quality of care for patients with life-threatening or life-limiting illness. And it works with patients and families through prevention and relief of suffering and communication about goals of care. So that doesn't sound very different from hospice care, but the biggest difference between palliative care and hospice care is that when someone is receiving palliative care, they can also explore curative treatment options. So when someone is on hospice care, it is strictly comfort. There are no more curative, no more aggressive treatments. So oftentimes, as illnesses progress, patients are referred from palliative care to hospice care because they could use the added layer of support. So there are 4 areas within end-of-life care: physical comfort, mental and emotional needs, spiritual issues, and practical tasks. So we try and alleviate suffering in all 4 of these arenas using an interdisciplinary team, which is made up of a nurse, a social worker, a spiritual care person, sometimes there's a home health aide involved, and then a physician. So for physical comfort, that can mean pain or breathing problems, making sure that those are under control. Mental and emotional needs are for addressing depression, anxiety, concerns about the unknown. Spiritual issues is finding meaning in one's life or ending disagreements with others. So you may have a patient who hasn't spoken to her sister in 50 years, and she may not be able to die peacefully until that disagreement is taken care of. So we try and work together to make sure that that need is met. And the last one is practical tasks. So that's everyday tasks and who's going to take care of things when they're gone. A lot of the times we have patients that are really, really concerned about how life is going to go on without them, especially if they are the ones that were the breadwinner or the ones that did everything for their families. That's a really real concern. Who's going to take care of them when I'm gone? There are challenges that are experienced by caregivers as well. So they include isolation, fear, caring for more than just a loved one, difficult decisions, and feeling angry and or guilty. So being a primary caregiver can be very, very isolating because care requirements can be staggering, which means we don't really know how much care is going to be needed on a day-to-day basis. It changes daily, or it could even change up to hourly. So a caregiver may not want to leave the home or take a shower or take a nap or take care of themselves because there may not be many days left. So they're reluctant to establish a schedule for self-care or to ask for help. A lot of the times I hear them say, oh, I'll take care of myself later, or I just want to take care of them right now. I'll take care of myself when this is all over. So as a caregiver, it's really important to remember to ask a family member for help at least once a day, even if it's a menial task like going to the grocery store. Practicing self-care, whatever that may mean to you, so eating well, going to the gym, sleeping, taking a nap, and researching what outside help is available so that you don't have to do this all on your own. So the next one is fear, and feeling unprepared and unequipped to do something that you've never done before is fear-inducing. It just is. So fear of the unknown is a lot of what the social workers delve into with patients and their families. So some of those questions that come up when talking about fear of the unknown include, what happens at the time of death? Will I be able to handle it? And how will I face life without my loved one? So suggestions for addressing fear are learning as much as you can and utilizing a professional. Utilize somebody who does this on the daily. Use them as a resource. Learn as much as you can. Let them teach you. Let them help you. And discuss any of your fears with someone who can address that specific concern. So a social worker, a nurse, or a chaplain, a doctor, someone. And then the next one is comforting more than just a dying loved one. While acting as a caregiver for a loved one who's dying, they may also be expected to provide sympathy and support to other people who are involved. So a primary caregiver is not only taking care of the dying individual, they're taking care of everyone else in the family. They're expected to be strong. They're expected to put on a brave face. They're expected to just handle everything. And that, coupled with taking care of your dying loved one, is a lot for one person to bear. So suggestions for allowing yourself to grieve while acting as someone who's comforting everyone is set an example. So let everyone else know that you're grieving too, and that you think that you may want to seek assistance with the emotions that come with that. Whether that's talking to a trusted friend or a family member, or talking to your social worker, or talking to a chaplain, or even a nurse. Just let them know that it's okay to talk about it. The next one is to accept the vulnerability and fragility of your emotions. Grief is a very raw and individual experience. It is personal, and everyone grieves differently, and every emotion that you feel when you grieve is normal. It's completely normal. And the last suggestion is, again, to lean into your support system. The next one is difficult decisions. So as a primary caregiver, you may also be given the responsibility of making the difficult decisions when a person is no longer able to do so. So you may be considered what's called the healthcare proxy. And that is making medical decisions in the event that a person is no longer able to. So you may be the one that has to decide when it's time to transition from curative care to comfort care, or when it's time to stop feeding or IV hydration, because there will come a time in the disease process where that can actually do more harm than good. And there's a really common misconception that if someone stops eating and drinking, that they will dehydrate and that they will starve. And for you and me, that would be true. But for someone who is experiencing the dying process, that's just a normal part of the process. And so suggestions for making difficult decisions are creating an advance directive. So what that can be is a healthcare proxy, or a living will, or a power of attorney, or all three, and communicating and learning your loved one's wishes while they can still communicate them to you. So these are really, really difficult conversations to have with someone, because it makes it real, and, we're taught to fight, but there will come a time when they don't want to fight anymore, and that's okay. And learning their wishes in advance is just going to make everything so much easier for you in the long run, because you're not going to be stressed to the max taking care of them and trying to figure out what they would want. They've already made the decisions for you. There's no guesswork. And the final challenge faced by primary caregivers is feeling angry and or guilty. And I'm just going to read a direct quote here. It's, anger is a common reaction when life seems out of control, and you may be angry at doctors, your relatives, or yourself. You may just be angry that your life is so difficult right now, and perhaps you feel guilty about these feelings, or you may have guilty regrets about what you have or have not done. So anger and guilt are two of the most common emotions that I run into as a social worker in hospice, whether it's during anticipatory grief, which is when your loved one is going through the dying process and you are anticipating their death and you are anticipating what life is going to be like without them, or if it's the bereavement side of things, so after the death has already happened. Anger and guilt are two very, very common emotions, and they're completely normal. They may not feel normal, and you may hate yourself for being angry, but it's okay that you're angry. Suggestions for anger and guilt: make physical outlets for your anger. So go to the gym, punch a pillow, take a walk around the block, scream into a pillow, something to get that anger out, because if you harbor that anger and you don't let it out and it just festers in you, that's really, really bad for your health in the long run. And as far as guilt goes, make a list of things that make you feel guilty and then cross off the items for which you can answer, I did my best with the information I had at the time. So a lot of what my work is with family members is talking to them about the what ifs. What if I had made a different decision? But what you have to realize is that you were given specific information at the time and you went with what you thought was best. In hindsight, you find things out. They say hindsight's 20/20, but you had no idea about this information then, so you wouldn't have made a different decision because you were only given the information that you were given. And again, like all the other ones, is lean on a trusted family member, use your support system. It's very important. So acting as a primary caregiver will probably be one of the most difficult things that you'll do. It's physically, mentally, emotionally, and spiritually exhausting. But it can also be one of the most rewarding things that you'll ever do. Everyone's experience is different, and it's hard to know what to expect, so the more education that you can get, the better. And always remember to take care of yourself. There is one take-home message that I want you to take away from this video, and that it is that self-care is the most important thing when you are caring for someone else. My favorite phrase to use with families is, "You can't pour from an empty cup." And what that means is, you can't take care of someone else if you're not taking care of yourself first. You need to be okay enough to care for another individual. And it's okay to admit that. And it's okay to do things that you need in order to take care of them. So just take care of yourself and take care of each other.